Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Judd Semingson, and he is CEO of the Community Clinic. Judd, thanks so much for joining me.
Robin, it's my pleasure. Thanks for having me.
So tell me a little bit about the Community Clinic and what you do.
Robin, at the heart of who we are and what we do is connecting to primary health services. We are an ambulatory care group that encompasses now over 19 locations in the Northwest Arkansas area. We're located in the Benton and Washington County area. And that health promotion and health delivery is really broad. At our core, it's medical services and what that can look like from sick care or well care and more. We also have 2 large dental clinics and a multitude of wraparound services, but really providing accessible care in an outpatient primary care model is who we are.
And there are some misconceptions about the Community Clinic. Tell me what those are.
Absolutely. I think, again, as I'd like to say we're sometimes the best kept secret. And we know that in today's world, especially with a variety of constraints, financial constraints, social determinant constraints, many times individuals, families, households have a lot of challenges that they have to overcome in order to maintain their health. And that's really the connection that we want to be for many of our patients. And so sometimes the misconception is that we only serve a certain community or only serve a certain individual. And the reality is we see that those needs are broad. And so we want to come alongside of our health systems and our other healthcare partners and making sure that we're really making those deeper connections with patients and families. And so who we serve really can be a broad footprint for us.
And I know socioeconomic stressors play a big role in healthcare in Arkansas. How does that affect your clinic?
It is core at what we do and how we operate. And that's going to look different. Again, our footprint is in Northwest Arkansas. And we are fortunate in this area. We do have a fair amount of resources. And our delivery of those health care and ultimately goals of good health outcomes are going to look different than where we are here versus some of our sister organizations or other health clinics that may be in the South Central or the eastern side of our state. And we know that those challenges that individuals have are going to vary from location across the state. But backing back up to our service area, we can see everything from financial constraints. Housing is really a big topic in Northwest Arkansas and how we can accommodate affordable housing. Because again, if individuals, if families are putting more towards that housing budget, then there's less to be able to spend on good food, reliable transportation, or other aspects of life that can affect our health and well-being. So this is not either or. And when we talk about the connection of the social and socioeconomic impact, and as I said earlier, we really see that this can impact a wide variety of households and families. There was an interesting article that came out within the last year that talked about how there were households that were making more than $100,000 a year that were still living paycheck to paycheck. And so those realities and those challenges abound, even though we may think that a family is doing well, there's still challenges. And so our goal with all of that is to be that connector. Because it may be simply the connector to food, clothing, housing, transportation, some of the basics of what others may take for granted. And for some households, it may simply be 1 or 2 of those connect points that they need. And really, how do we make sure that we're meeting those families where they are with what they need?
Social determinants also play a pretty big role as well.
Absolutely. We see things, and again, the challenges of families and households that can have to overcome food insecurity. We've been very fortunate. We've worked with groups locally to really be diligent at how we overcome that. We've seen our schools really be very proactive in the work that they do, and we've come alongside in some of that work for instance, with our Springdale school partners, some of our other school partners that we have. And again, connecting those families to some of the what we'll call basic needs so that they can continue to work on the health outcomes. We can also see even within the social determinants, and while it's not a direct component, but language access is so very important as we talk through what health means to families and making sure that those social determinants are being delivered in a culturally sensitive way.
And how are you connecting patients to health and wellness?
That's a great question. And I will fully admit that's one of the challenges that we face today, because in many cases, our system as a whole is set up to be sick care, meaning that we're treating disease or we're treating illness, and we're trying to get people better as opposed to trying to keep people well. And so that is a million-dollar question in a multitude of ways. And it's really something that we try to take a proactive approach. And so I'm going to come back to food as an example. And today we're working with local groups and local growers to deliver and connect our families, our patients, with in-season locally grown produce. And we're connecting by giving some recipes that the families can use to take that locally grown produce. Sometimes it's produce that may not be normal for that household. Kale, rainbow chard, things that we may see watching television, but sometimes families are questioning, well, how do I incorporate this? And so our work is to come alongside and infuse those opportunities, those healthier diets into the lifestyle. And by doing that, really try to create that sense of well-being and wellness. This is work that we're continuing to evolve under our own umbrella, and then working with other health systems. There's a lot of individuals, there's a lot of groups that are part of this work alongside of us. And the beauty of some of the collaboratives here are that we don't stand alone in that role. We're working with other health systems, we're working with insurance companies, we're working with larger employers and smaller employers to try to craft opportunities to infuse that well-being and wellness into the daily lives of our communities throughout Northwest Arkansas.
And you touched briefly on the different locations. So tell me a little bit about the schools, the clinics based in schools. And you said that those are in 2 different counties?
Correct. So again, our footprint, we're in Benton and Washington County, and today we now have 11 different school-based clinics operating in 6 different school districts. And so those districts can be large, those districts can be smaller communities, and those school-based clinics will look a little different throughout those communities. The premise of those school-based clinics are really to be an access point for the communities, for the students and the staff, teachers of those schools. And we talk about maintaining health. It can be anything and everything from well child checks, from vaccines, to sick visits if a child is sick, if a student is sick. And this is coming alongside the school nurses. So the school nurses today are working harder than they ever have before. So this is not to take the place of the school nurse. It's really to augment and deliver that next level of care, not higher level, but the next level of care, really to the nursing system that's within the schools, and help the schools maintain that consistency. We know that sometimes if a child is sick, that means that mom or dad is going to have to leave work and or take brother or sister out of class to go with them to the visit. Sometimes we are able to see the child. If the parent wants to give consent, we can see that child independent of the parent. And with technology today, we can also bring that parent in virtually to that visit so that there's a great connection there, or by telephone, so that our goal is to connect the parent to the child and whatever is needed at that moment in time, and lessen the impact to the family unit.
So it sounds like this can greatly increase the healthcare component for families and kids within these school districts.
We have seen a very positive outcome in many of the schools that we're in, and we continue to work to get that word out. I mentioned before some of the knowledge base of this, and the clinics really serve a variety and a depth of again, wellness opportunities and sick opportunities. So yes, is the short answer to your question. It's a wonderful opportunity to partner with our communities, with our school districts, and provide that access point for students, for parents, and ultimately, of course, for staff and faculty.
And you've talked about the broad scale of all that the community clinic offers, but what would you say your goal is as CEO? What's next for community clinic? What do you see as your vision as the next big goal?
Ultimately, for me and hopefully for the rest of community clinic, it's really to increase the impact. And when we think about health outcomes, again, we're very, very fortunate to be in the northwest part of the state with a lot of resources. We tend to see this area be healthier when we look at health outcomes, but there's still a lot of need. And so part of the goal is to broaden the impact and make sure that we're connecting better with families, with communities, because community can mean a lot of different things. And so community clinic is in your community, whether or not that's your city, your geographical area, whether or not that's a cultural connection, whether or not that's your group of friends and family and kids at the ballpark. Whatever that is, we all have a variety of communities. And so how can we do better at infusing the wellness aspect and keeping people healthy? So my goal really is to increase our impact in Northwest Arkansas and working with a lot of our other organizations across the state. We work with hospital systems. We work with other community health centers. We work with independent practitioner groups, independent physician groups, is to not just keep this in Northwest Arkansas, but to share best practices across the state, and ultimately to continue to lift up these opportunities across the state and make sure that we're improving the health outcomes of Arkansas.
Well, before we go, I wanted you to tell me a little bit about this integrated healthcare model where you're bringing in, or you have behavioral health professionals that are also in the clinic.
Yes. So really, we try to have a host of wrap services that are part of how we take care of patients. You can talk about that being integrated health, or sometimes it's referred to as whole health. And really, that can be a broad scope of care delivery. So oftentimes when we think about healthcare delivery, we think about going to the clinic and seeing the doctor, or the physician assistant, or nurse practitioner in that moment in time. And broadening that is a goal that many of us have. And that can incorporate other care team members, such as behavioral health consultants. For us, behavioral health consultants, we know that there's a large need when we talk about mental health. And so that is an augment for our providers to come alongside with our patients and help to decrease some of the depression and anxiety components that we see today. It can be also chronic disease management as we think about behavioral change and how the individual consumes that behavior change and then puts that towards being or living a healthier lifestyle. So behavioral health consultants are part of that care list. There's a whole host of team members that are part of this process for us that we are able to then use and deliver that care with our patients.
Translators as well. You have several of those in your office?
Indeed. I mentioned before, language services are so very important. And specifically, as we look at Northwest Arkansas, the need for language services is vast. And recalling last year's report from the Northwest Arkansas Council, I believe the 4 or 5 largest school districts, there were close to 85 different languages spoken across the different school districts in Northwest Arkansas. We see, again, that cultural diversification that's happening. Clearly, we have a large Spanish-speaking community. We have a large Pacific Islander and Marshallese community. And so for us at Community Clinic, many of our team members are multilingual. And so for us, that allows us to ensure that we're connecting with the patients that we serve, wherever that may be. And so in Springdale, there's a whole host of team members that come alongside this journey with us, from medical assistants to community health workers to dental assistants, et cetera, that make sure that we're taking care of all of our patients in a manner that's connected for them as well.
Well, Judd, thank you so much for talking to me, and the services and the vast array of services that you guys are providing for the Northwest Arkansas community is so important. I appreciate the work that you do. Thank you so much.
Well, it's been my pleasure. Thank you for having me.
And that's it for this episode of AFMC TV. I'm Robin Ledbetter. Thanks for watching and have a great day.